Key points: rise of non-communicable diseases, NCDs. NCDs, including ischemic heart disease, diabetes, strokes, chronic kidney disease, and chronic obstructive pulmonary disease, are the leading causes of death in Pakistan. These diseases, which have overtaken communicable diseases since 2010, are chronic and require long-term management. Concerning statistics, between 1990 and 2019, diabetes in Pakistan increased by 75 to 100%. Today, 33 million adults suffer from type 2 diabetes, placing Pakistan third after India and China. An additional 11 million adults have impaired glucose tolerance, and nearly 9 million cases remain undiagnosed. Similarly, ischemic heart disease has increased by over 25% and is the second leading cause of death. Risk factors in lifestyle medicine. The WHO identifies 5 key risk factors for NCDs: tobacco use, unhealthy diets, physical inactivity, harmful use of alcohol, and air pollution. To address these, lifestyle medicine offers a relatively new approach that emphasizes preventive lifestyle changes as a primary treatment for chronic conditions like cardiovascular disease and diabetes. Focus on lifestyle medicine in Pakistan. Dr. Shagufta Feroz, founder of the Rifa Institute of Lifestyle Medicine, is promoting this approach in Pakistan. The field, which focuses on lifestyle interventions such as healthy diets, exercise, stress management, and positive social connections, has gained recognition, though it faces challenges in becoming mainstream. Challenges and future direction. The article raises 4 key questions. Should lifestyle medicine be a specialized field or part of general practice? How can it be integrated into primary healthcare? How should health professionals be educated in lifestyle medicine? How should the medical and food industries, along with environmental agencies, collaborate to reduce health risks? Crux: non-communicable diseases are a growing threat in Pakistan, with lifestyle factors being major contributors. Lifestyle medicine offers a promising approach to managing and preventing these chronic diseases through lifestyle changes, but questions remain about how to mainstream this approach into the healthcare system. Collaboration between health professionals, industries, and policymakers is essential for effectively combating NCDs. Key points: IMF's 24th Program for Pakistan. The recently approved IMF program for Pakistan follows a traditional approach, focused on achieving a primary surplus or deficit without addressing the country's deeper structural economic issues. It mainly rolls over existing liabilities without pushing for meaningful reforms, particularly in tax and economic management. Focus on revenue generation. The program's main goal is revenue generation, relying heavily on state bank profits, which come from loans to the government. This revenue structure is unsustainable and undermines efforts to address core fiscal issues. Complexities in reform. The IMF program expects immediate compliance with unrealistic documentation standards for sectors like agriculture and exports, without considering the on-ground challenges. This quick shift to documentation may destabilize the economy further. Unjust tax structure. Pakistan's tax system has become increasingly convoluted, relying on import tariffs and arbitrary taxes, leading to business uncertainty and pushing many towards the informal sector. Repeated changes in tax policies further erode trust between the government and businesses. Bloated expenditure. The government continues to spend excessively on redundant agencies, infrastructure, and social programs, creating long-term liabilities without proper accountability. Expansion of the Public Sector Development Program (PSDP) and poorly managed workforce costs also contribute to the problem. Regulatory burdens and market distortions. Government controls and price fixing affect around 70% of the economy, leading to inefficiencies, blocked opportunities, and high costs of doing business. Pakistan's market remains heavily regulated, limiting growth and innovation. Exchange rate control. Despite the IMF's calls for market-determined exchange rates, Pakistan continues to manipulate the exchange rate, which distorts market dynamics, reduces export competitiveness, and worsens the balance of payments. Tariff and export issues. Pakistan's excessive reliance on tariffs and non-tariff barriers has negatively impacted exports. Successive IMF programs have exacerbated these issues by protecting the exchange rate at the expense of export growth. Crux: the IMF's 24th Program for Pakistan continues to focus on short-term revenue generation without addressing deeper structural problems in the economy. The tax system, expenditure priorities, regulatory framework, and exchange rate policies all require fundamental reforms, but these issues remain largely ignored. The IMF's approach, combined with Pakistan's political and economic inefficiencies, perpetuates a cycle of low investment, low growth, and low exports, leaving the country trapped in an unsustainable economic model. Key points. Challenges of teenage years. Adolescence is a challenging phase, marked by physiological, mental, and emotional changes. Teenagers require proper guidance on puberty, which is often neglected due to societal norms and taboos. The responsibility for this guidance generally falls on families and teachers, but it is not always fulfilled. Curiosity and misinformation. When guidance is not provided, teenagers often turn to peers or technology for information. This leads to misinformation and unhealthy exploration, particularly through the easy access to pornography online. Educational efforts. Efforts to provide proper sex education have been made by organizations like AHUNG, which publishes life skills-based education books, and by Dr. Shersha Syed, a gynecologist, who recently launched the book Ami Bataye. These resources aim to educate children in an informed and appropriate manner. Societal responses. Responses to educational materials vary. Some uneducated mothers showed great interest and curiosity, while young students reacted indifferently, revealing that they already knew much about the topic through inappropriate sources like YouTube. Impact of online pornography. Pakistan ranks third globally in online child pornography. Despite efforts to block such websites, the country faces significant issues related to child abuse and the widespread consumption of pornography. Watching pornography has damaging effects, including addiction, distorted views of relationships, and negative self-perception. Mental health consequences. Mental health professionals report that many adults struggle with pornography addiction, which is isolating and harmful to mental health. It distorts beliefs about human relationships and sexuality. Government neglect. The author criticizes the government for neglecting the pressing social issues related to youth education and protection. A balanced education, combined with sports and games, is essential for equipping youth with self-defense mechanisms against these societal dangers, but this is not prioritized by the government. Crux. The teenage years are fraught with challenges, and the lack of proper guidance on puberty and relationships often leads to teenagers seeking information through unhealthy means, such as pornography. Despite efforts from organizations and writers to provide educational resources, societal taboos and government neglect exacerbate the issue. The impact of pornography is damaging, distorting perceptions of relationships and causing addiction, while the government's focus remains elsewhere, failing to prioritize youth education and protection. Key points. Pre-hospital care saves lives. Emergency services with pre-hospital care can reduce mortality rates. Examples include Tamil Nadu's 108 service, which has reduced infant mortality and saved road accident victims, and Sri Lanka's Suasaria, which has the fastest response time globally, 12 minutes. Pakistan's Rescue 1122 service was launched in Punjab in 2004. Karachi's ambulance crisis. Karachi, despite being the largest city, lacks adequate life-saving ambulances. Most of the available ambulances are unequipped to provide critical pre-hospital care. Aman Foundation's life-saving ambulances. The Aman Foundation initially launched 60 life-saving ambulances, later handed over to the Sindh government in 2018 with a promise to increase the fleet to 200 ambulances for Karachi. Unfortunately, this commitment was not fulfilled. Sindh Medical and Rescue Service expansion. While SIRS has expanded its fleet to 411 ambulances across the province, only 31 new ambulances have been added to Karachi since 2018, despite the city's urgent need. Karachi, which hosts over 40% of the province's population, has been neglected in the allocation of emergency services. Personal ordeals due to ambulance shortages. Citizens face extreme challenges in acquiring timely ambulances. One instance involved a woman waiting for 3 hours to get an ambulance for her husband, who sadly passed away before reaching the hospital. Another account describes a long wait for an ambulance for the author's mother, ultimately relying on a private hospital's ambulance through connections. Logistical challenges and solutions. Some argue that Karachi's narrow lanes hinder the use of large ambulances. The author refutes this, suggesting that smaller vehicles could be deployed to bring patients to accessible points where larger ambulances could take over. Rapid response bikes. CSS has introduced 10 motorcycles for emergency response, which is a positive step but cannot replace full-fledged life-saving ambulances. Rising costs and increased demand. The cost of life-saving ambulances has risen from $75 million in 2018 to some $125 million in 2024, and the growing population means that Karachi now needs even more ambulances than previously estimated. Neglect of Karachi. Despite its diverse population and contributions, Karachi suffers from a lack of emergency services and support, leaving its residents vulnerable. Crux. Karachi, Pakistan's largest city, faces a severe shortage of life-saving ambulances, despite promises from the Sindh government to expand the fleet. The city's residents, including those in upscale areas, struggle to access basic emergency services, leading to tragic consequences. While some initiatives like the Rapid Response Bike Product offer hope, they cannot replace the need for fully equipped ambulances. The government's neglect of Karachi's emergency needs, coupled with rising costs and logistical challenges, has left the city underprepared to deal with its growing population's healthcare demands. Key points. No bilateral breakthrough expected or achieved. Indian External Affairs Minister S. Jaishankar's visit to Islamabad for the SCO summit didn't result in any major diplomatic breakthrough, and none was expected. Positive shift in diplomacy. However, the tone of Pakistan-India interactions was more civil and courteous compared to past hostile encounters. There were handshakes and pleasantries exchanged between Jaishankar and Pakistani officials. Diplomatic rhetoric. While Jaishankar repeated India's standard rhetoric about cross-border terrorism, there was no direct attack on Pakistan, and his comments were diplomatically phrased. India's engagement in multilateralism. Although Indian Prime Minister Narendra Modi skipped the summit, opting to send Jaishankar, India could have entirely avoided the summit but chose to participate, signaling some level of engagement. SCO as a regional platform. The SCO appears to be functioning better than other regional platforms like SAARC in bringing together Pakistan and India, likely due to the influence of China and Russia, which India may not want to antagonize. India's concerns and Pakistan's counter-concerns. Jaishankar mentioned terrorism and separatism as obstacles to better relations. On the other hand, Pakistan has its own concerns, including Kashmir, the treatment of Muslims in India, and alleged Indian support for subversive activities in Pakistan. Importance of dialogue. The SCO summit's joint communiqué emphasized resolving differences through dialogue. Dialogue between Pakistan and India is crucial for regional peace and stability, and it should address all core issues. Economic and regional integration. India's refusal to engage with Pakistan hampers its regional integration ambitions, especially in accessing Eurasian markets. Similarly, Pakistan could benefit economically from better relations with India. Cricketing ties and diplomacy. There were reports that cricketing ties were discussed during Jaishankar's visit, although this has been denied by India. Nonetheless, restoring sporting relations and reinstating high commissioners could pave the way for improved diplomatic relations. Crux. While no significant diplomatic progress was made during the SCO summit in Islamabad, the softened tone between India and Pakistan marks a positive shift. The potential for better relations through continuous dialogue and economic integration remains, though both sides must address long-standing concerns. Multilateral platforms like the SCO are proving more effective than others in bringing the two countries together, even for limited engagement. Key points. Climate change as a persistent threat. Climate change is an ongoing challenge for Pakistan, with recurring natural disasters like floods, droughts, and extreme heat posing an existential threat to the country's economic stability. IMF recommendation. The IMF suggests Pakistan should allocate at least 1% of its GDP annually to climate-resilient infrastructure to narrow the gap between current efforts and what is needed to combat climate challenges. Severe climate impact. Pakistan is among the top 10 most climate-affected countries, experiencing a higher rate of warming than the global average and greater climate variability, leading to worsening natural disasters. Investment in climate adaptation. Investing in climate adaptive infrastructure could reduce the economic impact of natural disasters, help recover from GDP losses faster, and improve overall climate resilience. However, Pakistan's economic crises and resource shortages limit such investments. Lack of global support. While international pledges for aid, particularly after the devastating floods of 2022, have not fully materialized, the responsibility also lies with Pakistan's policymakers, who have failed to prioritize climate resilience and renewable energy investments. Misguided energy policy. Pakistan continues to focus on coal-based energy rather than shifting towards renewable sources like solar and wind, ignoring the future environmental, health, and economic costs of this decision. Pakistan is facing severe threats from climate change, with the IMF recommending substantial investment in climate-resilient infrastructure. However, economic constraints, coupled with insufficient international aid and misguided domestic policies, are hampering necessary progress. Pakistan's continued reliance on coal rather than clean energy solutions highlights a critical failure in long-term planning, making it imperative for the country to revise its approach and prioritize climate adaptation and renewable energy investments to safeguard its future. Key points: improvement in macroeconomic indicators. While some improvements are observed in Pakistan's macroeconomic figures, these changes have not addressed the deeper structural problems within the economy. Broken revenue system. The current tax system is flawed, disproportionately burdening the salaried classes and registered businesses, while allowing the wealthy and powerful to evade their fair share of taxes. FBR's admission. The FBR chairman has acknowledged that even the wealthiest 5% of Pakistanis are not paying the taxes they owe, a startling admission given the economic crisis. Unfulfilled promises of tax reform. Despite promises that there are no more sacred cows for the tax authorities, little progress has been made in ensuring the rich pay their fair share. The finance minister has repeatedly lamented the pressure on those already burdened, but no substantial action has followed. Delayed taxation on agricultural incomes. The long overdue taxation on agricultural incomes has been postponed yet again, now expected to be addressed in the next fiscal year. This shows a continued lack of urgency in broadening the tax base. Unfair burden on salaried classes and honest businesses. The article raises the question of why only the salaried classes and honest businesses are carrying the weight of the economy, while the wealthy, who have amassed significant resources, contribute little. Crux. While Pakistan's macroeconomic indicators may show signs of improvement, the structural flaws in its revenue system remain unaddressed. The wealthiest continue to evade taxes, leaving salaried workers and businesses to bear the burden. Despite government promises of reform, little has been done to ensure fair taxation, and the delay in taxing agricultural incomes further exacerbates the inequality. The article calls for urgent answers and action to address this imbalance.